Hi friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. So today we're going to talk about doing cranial alignment, cranial sacral therapy, just the cranial portion, on yourself at home. You can also do this on somebody else, but I'm going to show you how to do it on yourself. And the purpose of this is for patients that have come in that we're doing cranial work on, and maybe I've said to you, okay, when you're at home, I need you to do this if you start feeling bad or if you just want to help yourself along. As a disclaimer, I did not study cranial sacral therapy with the Upledger Institute, but that's what I recommend you do if you want to do a full course for a layperson to learn how to do cranial sacral therapy. It's a fantastic seminar, and it is something that your family will greatly benefit from. So I did study with Carol Phillips, who's a chiropractor. It was a course along with the ICA pediatric certification course. And I learned Carol's course where she focuses on infant cranial work, which I do. If there's any disparity between what Upledger teaches and what I teach, that's why I do it a little bit differently. So if you're doing this on yourself at home, the only thing you really need is a chair to sit in and a pillow. The reason for the pillow is you're going to be having your hands on portions of your head for more than a minute or so on each spot. So your arms will get tired if you just are holding them up. So it really helps if you have a pillow. You can do this also laying down. Like if you find that you wake up in the middle of the night and something's bothering you, you can also put the pillow on your chest and just do the cranial work laying down. So the first position I'm going to show you is the first position that I start with when I'm doing cranial work, and that is the frontal bone. And you'll feel on the side of your head, you've got these ledges of bone on either side. It's where Herman Munster put his electrodes right there. So you want to take your hands like this, so your palms are facing forward. Use your index fingers. Find that bump right there. You want to go behind that bump. Use it as kind of as a ledge, and you're going to use some very gentle forward pressure. And by pressure, I mean barely the weight of your fingers. They say that the pressure you use with cranial sacral therapy is about the weight of a dime. So I'm just resting my fingers on the frontal bone. And as you know, if you've had cranial work done, you might feel something. You might feel a little movement either in your fingers or within your head. That's okay. So if you're doing this at home, hold the pressure for 1 to 4 minutes. When you're done with that, you can move on to the next, which is the parietal bone right here. And if you fold down the tops of your ears, you will feel that there's a ledge right there at the top of the ears. The motion for this, when you're holding the pressure, is up towards the ceiling. So you're going to face your palms up, get your index fingers on that ledge on both sides, and it's just gentle, very light forward pressure up. And again, you're going to hold this for 1 to 4 minutes. When you're done with that, we'll go to the sphenoid. This is a very common misalignment of the cranium to have. The sphenoid bone actually sits within the cranium. I like to say it's the hammock that the brain sits on. It's actually a very large bone, but the only piece of the bone that's on the outside of our cranium is here and here. So you're going to take your index fingers again, and you're going to be facing your palms forward again, and there's a little dip right there at the temple, and you want to kind of get your finger in that dip, not in front of it, not behind it, but in that dip. And again, 1 to 4 minutes. The next one we're going to work on is right here, the vomer. And what you'll do is take 2 fingers, and the idea is to move your fingers apart. So I'm hooking my fingers a little bit. One is going to go right here on the bridge of my nose, the other one on my nose, on the cartilage of my nose there. And again, just very gentle, not even pressure, just the weight of my finger, one going up, one going down. There's 2 more we'll do. The temporal bone, and the temporal bone, your ear sits in your temporal bone. So we're going to use our ears to pull on the temporal bone. If you're an adult, you're going to pull at a downward 7 o'clock and 5 o'clock angle. And it's just, you're going to grasp your ear, and it's gentle pulling, 1 to 4 minutes both sides. The last one is going to be the occiput. We're going to use our thumbs. I'll turn around so you can see. The occiput is the ledge right here. You'll use both thumbs. And you're going to use upward pressure. Upward pressure. Notice I have my fingers facing towards the ceiling. 1 to 4 minutes. So there. That gives you some way to help yourself when you either can't make it to the office or you just need to do something for yourself. So we are putting the knowledge and power of your health back in your hands. Bye for now.